Order. Before we begin, can I encourage members to wear masks when they are not speaking? This is in line with current government guidance and that of the House of Commons Commission. Please also give each other and members of staff space when seated and when entering and leaving the room. Elliot Colburn to move the motion.
Thank you, Mrs Garney, and it's a pleasure to serve under your chairmanship. I beg to move that this House has considered E-petitions 575-801, 577-842 and other associated E-petitions relating to Covid-19 vaccination. I'm glad that we have another opportunity to discuss vaccinations in this House, and I'd like to begin by thanking the NHS, pharmacists and volunteers in Carshalton and Wallington, but across the UK, for making our vaccination programme such a huge success. And I'd particularly like to thank Rena from SG Barai Pharmacy in Carshalton and Wallington for administering my own Covid-19 vaccinations. I'd also like to start by very much welcoming the Minister to her place today. I believe this is her first debate that she's responding to as Minister, and I've always found her to be nothing but courteous and friendly, so I wish her all the very best in her new role. Mrs Garney, I would like to draw the House's attention to the Government's responses to these petitions, which I think sets out very clearly that the Government is indeed thinking very carefully about matters such as certification and vaccine status, and considering all issues prior to making a decision. And I'm sure the Minister will want to elaborate on those responses in her response to today's debate, so I'll not steal all her material. But as this debate gives us an opportunity to discuss vaccinations once again, I would like to use the opportunity to urge everyone to book their slot for vaccinations as soon as they possibly can. And I particularly welcome the news today that we are beginning our booster jabs programme, something that I'm sure, again, the Minister will want to touch on a bit later. But, Mrs Garney, it's true to say that COVID has not gone away. Whilst we are unlocking and whilst we are rediscovering many of the freedoms that we have sacrificed over the last 18 months, people are still being hospitalised and are still dying from coronavirus. And I think the data here speaks very much for itself. The majority of those being hospitalised and the majority of those who are dying from Covid-19 are those who have not been fully vaccinated. So it's clear that by getting vaccinated, we're not only protecting ourselves, but others too, and are playing our part in bringing an end to this pandemic. Because vaccines truly are a marvel of modern medicine. One that we can be proud was discovered by a Brit, Edward Jenner, who demonstrated that with a mild infection with the cowpox virus, conferred immunity against the deadly smallpox virus. And cowpox did indeed serve as the natural vaccine for smallpox until more modern vaccines were brought out in the 19th century, which laid the groundwork for the system of vaccinations we know today. And smallpox remains the only virus considered to be eradicated internationally since 1980. Now, since Jenner's discovery of vaccines as we know them today, vaccines have been developed and helped to offer immunity to a whole range of viruses such as measles, mumps, rubella, influenza, tetanus, polio, diphtheria, yellow fever, rabies, hepatitis, polymyrovirus, meningitis, and so many more. It is easy, therefore, I think, to take vaccines for granted. But I would just like to invite the House to consider for a moment just how much of an impact that vaccines have had on the world. These illnesses are things that would have once struck dread, fear, and anguish into the hearts of the patients who were diagnosed with them. Yet today our lives are quietly unaffected. Unaffected by these horrors, we just go about our day unworried by them, by a seemingly simple concept of a jab which is over in a matter of seconds, which allows us to carry on our lives protected and healthy. And these miraculous vaccines must pass extremely rigorous testing before they are licensed for use in the UK. According to the Oxford Vaccine Group, the following are just some of the stages that a vaccine has to go through before use. It includes a literature review to review what has been done before, a theoretical development or innovation, coming up with a new idea or varying on an existing one, laboratory testing and development involving in vitro testing using individual cells and in vivo testing, which often uses mice. This then must go through 3 stages of human trials before licensing and reviews, and then continues to be monitored after its approval for wider use to take note of any new developments. And Covid-19 vaccines have been no different. They've had to go through this same testing criteria. Yes, there have been questions about speed, but Dr. June Rain, the Chief Executive of the MHRA, has explained perfectly clearly how the UK was particularly able to approve this vaccine so quickly. So my message to anyone who still has apprehension about getting their COVID-19 is please, please, please do speak to your GP or your pharmacist to get the facts. And this is an important point. Speak to the professionals with the years of knowledge and training. Now, we've all had a bit of a laugh over the last week and a half about Nicki Minaj and swollen testicles, something that I never thought Mr. Carney would say in the House of Commons. But it does raise a very serious issue. The rates of vaccination drop as you go down the age groups, and it's important that the government is finding ways to reach younger people, to encourage them to protect not only themselves, but others around them by getting the vaccine, especially when they are being fed misinformation, downright lies, and mad conspiracy theories by people with hidden agendas in the pockets of well-funded and well-organised anti-vax movements. So I agree with Professor Chris Whitty that these people are preventing someone from getting the potentially life-saving vaccine, and they should be utterly ashamed of themselves. So my message, Mrs. Carney, is to urge everyone to speak to their doctor, to get themselves vaccinated, protect themselves and those around them, and help bring an end to this awful pandemic.
The question is that this House has considered E-petitions 575801 and 577842 relating to Covid-19 vaccinations. I now turn to the SNP spokesperson, Ms. Anum Kaiser Javed.
Thank you, Mrs. Ghani. It's a pleasure to serve under your chairwomanship. And I begin by commending all those across the 4 nations that signed the 2 petitions. By signing, you have made your voice heard and you're participating directly in democracy. E-petition 577842, which states do not require health and social care workers to take the COVID-19 vaccination, has been signed by 59 individuals in my constituency of Airdrie Shotts, and the other E-petition 575801, outlaw discrimination against those who do not get a COVID-19 vaccination, has been signed by 275 individuals in my constituency. I'll start off by thanking the member for Carleton and Wallington for moving these petitions. And I join him in thanking the NHS and those across my constituency of Airdrie Shotts who've been involved in the vaccine rollout, not just in administering the JAG, but also those in the background who are working equally as hard. And may I also take this opportunity, Chair, to congratulate the Honourable Member for Airwash on her recent appointment as Vaccines Minister. There will no doubt be matters on which we disagree, but I extend a warm hand to her in this role. Chair, evidence shows us clearly that the vaccination programme has gone well across the 4 nations of the UK. Scientists and many politicians from across the political spectrum are in agreement that a strong vaccination programme is the safest way out of the pandemic. Around the UK, on average, 80% of those eligible have been double vaccinated and 90% have received their first vaccination. In fact, recent statistics demonstrate that there's a significant impact that the vaccine has had in driving down death rates. Only 1.2% of deaths in England from COVID between January and July were from those who were fully vaccinated. And now, this general plan to save lives and avoid disruption includes vaccination of those aged 12 to 15, alongside the plan for booster JAGs for those over 50 and NHS staff. And because I'm Scottish, I say JAG, not jab, in case any of you were confused. However, there remains 1 million people over the age of 60 who are not double vaccinated in the UK. And the number of vaccinated must be increased to minimise further deaths and hospitalisation from coronavirus. Vaccines in the UK have been extensively studied and have been proven safe for use. Over 2 billion people around the world have now been vaccinated against COVID-19, and Evidence shows us that the benefits of vaccination significantly outweigh the potential risks. Therefore, it's time to encourage the remainder of the population who have not yet been vaccinated to get the jab. Chair, we in the SNP take the position of not voting on issues that do not relate to Scotland, and as such, the SNP did not participate in the vote on regulations relating to mandatory vaccinations for English care staff. However, my friend, the Honourable Member for Central Ayrshire, spoke in the debate on behalf of our party. She spoke against mandatory vaccination in this debate and highlighted the impact of vaccine hesitancy. My friend also highlighted that Scotland has a higher rate of vaccination among care home staff without the need of vaccination mandating. Vaccine uptake is vital, Chair, and the Scottish Government believes in encouraging uptake of the vaccine through informing people about the medical facts and explaining the advantages that vaccination offers them and their loved ones. Requiring the mandatory vaccination of care home workers will not support the vaccine rollout, but may potentially undermine it. This is why the SNP spoke out against the proposals in support an informed vaccine rollout. The Scottish Government, Chair, is aware of the ethical concerns around vaccine passports, but accept that they are likely to play a role in keeping the pandemic under control. Scotland's vaccine passports will be required in nightclubs, live indoor events with more than 500 people unseated, outdoor live events with more than 4,000 people, unseated attendees, and any event with more than 10,000 people. And the Welsh Government have in fact announced a near-identical plan for Wales beginning in mid-October. Now, the UK Government has currently shelved its plans for vaccine passports for now, but who knows what they'll say tomorrow, and I look forward to hearing if the Minister has any comments on that. And currently, as we may be aware, the Northern Irish Executive has said that it's got no plans to implement a similar scheme. The latest estimates for the proportion of 18 to 29-year-olds who are unvaccinated stand at 25.6% in Scotland, and it's hoped that schemes like these will encourage youth uptake of the vaccine. And proof of vaccination will be really important in a post-pandemic world to facilitate travel and tourism, which of course are vital to our economy. And proof of vaccination has been the case for many countries for various vaccine-preventable diseases for decades. In fact, as someone from a Pakistani heritage, I remember being younger and being dragged to the doctors to get my vaccines in order to visit my grandparents. And actually, Chair, as someone growing up, I was very frightful of vaccines. But I still persevered and got with it so I could go visit my grandparents. So this is not something that is new. It's important to note also that the proposals, both in Scotland and Wales, actually fall short of the requirements in place in European countries, such as France or Italy, which required the EU Green Pass or equivalent for visiting any hospitality settings indoors, using trains and cultural attractions, and Italy is now even requiring proof of vaccination in the workplace. Both Labour and the Tories opposed vaccine passports in Scotland, and allegedly on grounds on how it's being implemented rather than as a principled position against the proposal. And the Lib Dems in Scotland have opposed vaccine passports throughout the UK. It's really important that we do know that the Scottish Government has no plans to introduce the requirements for public settings in which people need to visit, such as shops or public transport, and individuals will continue to have the right to work, shop and meet people without vaccination. I conclude by stating a really important point, Chair, which my honourable friend had mentioned in his opening remarks. People have the right to refuse vaccination, yes, but they do not have the right to spread dangerous misinformation. Violence and intimidation are not acceptable. And I highlight the case of Mariana Spring, who covers disinformation on social media for the BBC. She, this weekend, shared a video online where it appears that an anti-vaxxer protester is calling for her to be tried for war crimes. Mariana explains that she's received death threats and rape threats. Tackling misinformation is a responsibility for all of us as elected members. And I welcome any advice that the Minister can provide in ensuring that people have the full facts and are making an informed decision when deciding to take the JAG.
Thank you. I now call the Opposition spokesperson, Mr Jack Dromey.
Thank you, Madam Chair, and it's a pleasure to serve under your chairmanship. And can I also welcome the Minister to her position in government and here today. One of the welcome innovations of parliamentary democracy in recent years has been the notion that the public can trigger debates by way of e-petitions. And we're here, therefore, to debate 2 e-petitions that have commanded very significant public support. Can I start by saying that I think the honourable member was absolutely right when he talked about the remarkable triumph of British science, that is the development of the vaccines. And all those who have been involved deserve huge credit, not least because the consequence has been to save tens of thousands of lives of people who would otherwise have died. Now, the Labour Party, we're committed to following the science, and we can see, as again has been said eloquently earlier on, that vaccination is having a dramatic impact, reducing hospitalisation and stopping people from becoming very ill with COVID. It's absolutely vital, and the honourable member from the SNP is right when she says this as well. It's absolutely vital that everyone who can get the vaccines should. And we need to send, therefore, that unmistakable and united message here from Parliament. By keeping uptake rates high, we can beat the virus. Anyone who is worried about the vaccine, and there are many, anyone who is worried about the vaccine should speak to health professionals about their concerns and receive proper advice, not, and I repeat, not to be influenced by anti-vaxxer fantasists whose advice is positively not just wrong, but dangerous to health and well-being. Now,
I'm grateful to him, and of course I agree with the points he's making. I was talking to a 14-year-old over the weekend, and she said that she had seen on the internet a magnet attracted to somebody's arm because they had been vaccinated. Would my honourable friend agree with me that the internet companies, the government, should, as soon as they possibly can, get that nonsense taken down?
The honourable member is absolutely right. Some of the propaganda that we have seen, including on the internet, is positively pernicious. It is not just positively pernicious, but if anyone is seduced into believing it, and as a consequence catch COVID and are not vaccinated and die, then those responsible bear a heavy responsibility and a heavy burden for what they are doing. And that means, therefore, that everyone with power needs to act, and that includes the internet companies, to be more proactive and dynamic in ensuring that shameful propaganda is not propagated on social media. Now, over the past year, Madam Chair, we have seen the tragic impact of coronavirus on our communities. So I stress once again, it's absolutely vital. The importance of taking the vaccine is constantly emphasised. In my own constituency, for example, I think of Jane Roach, who lost her father and then 5 days later lost her sister to COVID. And she remains distraught to this day, 1 year on. People like Jane know all too well just how important it is that vaccine uptake remains high so that no one should suffer the grief that she has. I therefore, like other honourable members who've spoken in this debate, I strongly encourage everyone to get vaccinated for their own protection, but also that of the wider community. And we would call on government to make a more direct effort in vaccinating those from communities where vaccination rates are low and vaccinating young people in particular. And I hope that the Minister, in her response, might be able to update us in terms of the efforts that the government is making, tackling this issue of problems in relation to low uptake. If I can then move on to vaccine passports in relation to the petitions before us today. Now, we understand why the public might be confused or anxious about perceived discrimination against those that are not vaccinated. And I have to say that the government's approach to COVID passports has been at times chaotic. There has not been consistent clarity from ministers about what vaccine passports were supposed to achieve, how they would work, and what was expected from the public, businesses and workers. And that meant that we had a degree of chaos over the summer and no real preparation before the winter. The vaccine minister stood before Parliament 2 weeks ago to confirm the introduction of COVID passports and stressed their importance, and then the Health Secretary days later said that they had been scrapped. No matter what measures are being introduced, businesses, workers and consumers need clarity from government, not conflicting messages and rapid U-turns. And therefore we have repeated many times that we would not accept any certification or passport scheme that was vaccine only. Now, in Wales, the Welsh Labour government has made some interesting progress on this very issue. They followed the data and applied a mandatory risk assessment which takes into consideration the full risk posed and then recommends a range of mitigations on that basis. For large events or close contact businesses like nightclubs, it mandates the use of the NHS COVID pass. This means in most business settings, using familiar mitigations like masks, social distancing and ventilation based on their risk level. In large venues, crowded events and nightclubs, the NHS COVID pass application is mandated for use, giving people the option of presenting a negative test result as an alternative to a full vaccination. Now, Madam Chair, we do not support the introduction of any scheme that only provides access to a service for the fully vaccinated. Free testing should therefore remain widely available so we can identify and isolate the virus. The approach in Wales has been welcome in other respects as well, in that it makes a clear distinction between venues such as local cafes on the one hand and Wembley Stadium on the other, where different mitigations for COVID are needed. Now, we do not also support any potential COVID pass scheme for access to essential services that does not get the balance right. This includes, but is not limited to, access to doctors and dentists, supermarkets and other essential retailers. For day-to-day routine access to the office, access to health services, dentistry or even food, we don't agree for that day-to-day routine access with vaccine passports. If I can turn now to healthcare workers. In relation to health and social care workers, we want everyone working in care homes to take up the vaccine. Absolutely essential. The vaccine is safe and effective. I stress again, do not believe the sometimes poisonous propaganda of the anti-vaxxers. But we do not support proposals or the case for compulsory vaccination. There are serious warnings from the care sector that the government's plan could lead to staff shortages in already understaffed care homes. This would have disastrous consequences on the quality of care. Again, the UK government should learn from the work done in Wales, which is running the fastest vaccination programme in the world and vaccinated a far greater proportion of its staff compared to England. Now, Wales has rejected compulsory vaccinations and instead chosen to work closely with the care sector to drive up take-up, as well as valuing the workforce, including with a proper pay rise. The government should be focused on driving up standards and retention of staff by treating care workers as the professionals they are, with improved pay, terms and conditions and training. We need all care homes and care workers to have proper PPE, regular testing and good training. If I could say this in conclusion, we are now approaching what is likely to be, Madam Chair, one of the most challenging winters in many years. The NHS has ever faced, and the top priority must be to protect the National Health Service. We urgently need, therefore, a plan from government that sets out the direction of travel at the next stages. Any plan for the winter period must first get vaccination rates up in areas where uptake is low. Second, outline how vaccinations for children will be rolled out and by when. Third, finally, fix the issues of self-isolation and sick pay. Fourth, provide proper ventilation in schools and public buildings. And fifth, provide a clear plan for businesses, workers and consumers. These are significant steps that the government could take to greatly improve the country's response to coronavirus. I hope, therefore, that when the Minister speaks, she might be able to outline in more detail what the government's plan is to fix these problems. Concluding, therefore, I'd like once again, as other honourable members have done across party, to emphasise the importance of vaccine take-up once again. Covid-19 vaccines have saved thousands of lives and been crucial in protecting the National Health Service. It is critical, absolutely critical, that we maintain the protection that the vaccine affords and send a clear and unambiguous message to all that vaccines work and anyone who can should receive the vaccine.
Thank you. I now call on the Minister to respond, Minister Maggie Throop, and welcome the Minister to the front bench and wish the Minister well. Minister Maggie Throop.
Thank you, Madam Chair. And I'm grateful to my honourable friend, the member for Carl Sholton and Wallington, for bringing this debate on these very important topics. And I commend him for setting out the importance of vaccines in combating so many disease areas. Because I think that when we look at the history of vaccination programmes in previous eras, we realise just what impact they have on people's lives. We know that the COVID vaccination programme is the nation's best line of defence against COVID-19. Vaccinated people are far less likely to face severe disease from COVID-19, to be admitted to hospital or to die from it. And vaccinated people are also less likely to pass the virus to others. More than 93 million COVID-19 vaccines have already been administered, and the latest estimates from Public Health England indicate that the programme has saved more than 112,300 lives and also prevented over 24 million cases. I would like to begin by paying tribute to everyone who has played a crucial role in the success of the vaccine rollout, as other honourable members have done today. And that's from our brilliant scientists, clinical trial participants, the armed forces, NHS England, frontline healthcare workers, vaccine volunteers, as well as local and central governments. Their life-saving efforts have helped us maintain the rapid pace of the rollout across the entire country. I would also like to recognise the brilliant work of the former Minister for Vaccines. I know that I have very big shoes to fill. The public's continued willingness to get vaccinated, to test and to self-isolate if they have symptoms, and to follow behaviours and actions that mitigate all methods of transmission has played a key role in lifting restrictions. Over autumn and winter, the government will aim to sustain the progress made and prepare the country for future challenges, while ensuring the National Health Service does not come under unsustainable pressure. As my first debate as Minister, Madam Chair, with the responsibility for vaccines, I would like to join with my honourable friend's plea and other honourable members for those not yet vaccinated to take up their vaccine offer and join around 89% of the UK who have had at least their first dose. I'm sure the whole House will join me in thanking them for playing their part in helping us all live safely. We will continue to make vaccines easily available to everybody to maximise uptake amongst those who are eligible, but have not yet taken up the offer to date. In England, 11.3% of people aged 16 and older, that's over 5.5 million people, remain unvaccinated, and this heightens the risk of rising hospitalisations, particularly when prevalence is high. Take-up so far varies by ethnicity, age and deprivation, with some groups recording lower rates of vaccine uptake than others. And building on lessons learnt through phases 1 and 2 of the vaccine rollout, the government continues to work closely with the NHS to make it as easy as possible to get a vaccine. And this includes through jab a jab in the UK, in England, pop-up vaccine sites across the country with an easy-to-use walk-in site find on the NHS website. And these pop-up sites include at football stadium, in shopping centres, and really reaching out to the whole community. And the government has also been partnering with transport providers such as Uber and FreeNow to ensure access to vaccine sites is as easier as ever before. The spokesman for the opposition asked how the government is reaching out to these hesitant people to take part in this vaccination programme. And despite being only in post for a matter of days, I would like to reassure him that the government and the NHS are working very closely together and to make sure that we do reach out and get to these extra 5.5 million jabs into the arms that we need to, and to fill that gap that's out there in the community. I would like to reassure him that it's one of my key priorities in my role as Vaccines Minister. However, the last 18 months have shown the pandemic can change course rapidly and unexpectedly, and it remains hard to predict with certainty what will happen. There are a number of variables, including the levels of vaccination, the extent to which immunity wanes over time, how quickly and how widely social contact returns to pre-pandemic levels, partly schools return and also offices reopen, and whether a new variant emerges which fundamentally changes the government's assessment of the risks. And that's why the autumn and winter plan sets out our Plan B. Vaccine owner certification will be part of the government's Plan B if the data suggests action is required to prevent unsustainable pressure on the NHS. For venues, certification could allow settings that have experienced long periods of closure to remain open, compared to more stringent measures which may severely reduce capacity or cause them to close entirely. The autumn-winter plan committed to publishing further details shortly on the proposed certification regime that will be introduced as part of Plan B. In this scenario, certification will be introduced in a limited number of venues. Communal worship, wedding ceremonies, funerals and other commemorative events and protests would also not fall under the certification regime. Exemptions would continue to apply for those who cannot be vaccinated for medical reasons, for those on COVID vaccine clinical trials and for under 18s. Now coming on to the COVID-19 pass. For now, the NHS COVID pass would continue to certify individuals based on vaccination, testing or natural immunity status, with more than 200 events and venues already introducing voluntary use of certification and the NHS COVID pass as a condition of entry. Turning now to care home staff, they provide a critical role in supporting the health and well-being of some of the most clinically vulnerable to the effects of COVID-19 in society, and have maintained their dedication and professionalism through highly challenging conditions. Since the start of the pandemic, the government has committed over £6 billion to local authorities through non-ring-fence grants to tackle the impact of COVID-19 on their services, including adult social care. And we continue to be committed to supporting the social care sector. To prevent individual susceptibility to COVID-19, from 11th of November, it will be a condition of deployment for anyone working or volunteering in Care Quality Commission regulated care homes, providing accommodation for persons who require nursing and personal care to be fully vaccinated. And thanks to the incredible efforts of people across the sector, over 1.2 million social care workers in England have now been vaccinated. This is a fantastic achievement and an important step for staff to protect themselves, their loved ones and the people they care for from becoming seriously ill or dying from COVID-19. Happily give way.
I'm grateful to the Minister. Can she answer the question that her predecessor failed to answer on the floor of the House when asked during the debate on the second reading why it will be effective to force reluctant care workers, and everybody agrees it would be a good idea if all care workers were vaccinated, but to force them either to have it or lose their employment when other people entering care homes, like hairdressers, musicians, entertainers, are not. How is that an effective policy?
Mrs. Rook.
Thank you for that question. And if you excuse me, if it's obviously been imposed a short time, then I can clarify it later. But as I'm led to believe that it's people who regularly go into care homes that will need this, it's not just restricted to the actual carers. And obviously, if anybody who needs to go into a care home in an actual emergency situation, that's a different scenario. But if I may clarify that after the debate. If I may continue. So, vaccine uptake nationally in the care home workforce is high, at 85.6% for first doses, and this is in line with vaccine uptake in the general population. There is, however, significant variation at a regional, local and individual care home level, and vaccine requirements are designed to level up uptake in the care home workforce. Whilst the majority of care home workers have been vaccinated, the latest published data, as of the 12th of September, highlighted that only 81.3% of older adult care homes in England were meeting the sage advice that 80% uptake of first doses among staff is needed at minimum to reduce the risk of outbreaks in these high-risk care settings. Whilst residents in care homes are some of the most at risk from COVID-19, the responses to this initial consultation on care home made a clear case for extending this policy to other settings where vulnerable people receive care and treatment. The government, therefore, is now seeking views on whether or not to extend vaccination requirements to other frontline health and care workers, those with face-to-face contact with patients and clients through the delivery of services as part of a CQC-regulated activity. Recent research has shown people infected with both flu and COVID-19 are more than twice as likely to die as someone with COVID-19 alone, and nearly 6 times more likely than those with neither flu nor COVID-19. So vaccination requirements for both flu and COVID-19 are being considered. I trust that this debate will have helped to dispel some of the myths that my honourable friends have raised around vaccinations, and really to reach out to the public, to ask them, as colleagues have done, to go and get jabbed, to be vaccinated, to protect themselves and to protect others. And, Madam Chair, to conclude, I'd like to reassure the House that we're doing everything we can to widen and deepen our wall of defence that the vaccine provides. The ask of our NH colleagues is challenging and complex, yet they have risen to this challenge and do it every day. And once again, I'd like to thank them for their dedication.
Thank you, Minister Sroop, and well done on your first time at the dispatch box or on the front bench. Mr Elliott Colburn, to wind up.
Thank you, Mrs. Connie. 52 minutes. Wow, I won't take it all. Could I just thank once again the petitioners, especially those in Carshalton and Wallington, for allowing us to have this discussion about vaccinations, and to all members for coming along to participate. I know that the government is considering certification and vaccine status carefully before making its decisions. I think we've heard some of the concerns about those expressed eloquently today, but I would just like to end by repeating the message that all of us have sent out here today, is that please do get vaccinated, protect yourself and protect others. And on that basis, Ms. Carney, I beg to move.
Thank you. The question is that this House has considered E-petitions 575801 and 577842 relating to COVID-19 vaccination. As many of that opinion say aye, of the contrary, no. The ayes have it. I think the ayes have it. Order, order. The sitting stands adjourned.
The proceeding has ended. The proceeding has ended. The proceeding has ended. The proceeding